in the head and neck, like bones of the visceral cranium. These are from neural crest. Some part of the teeth, they have neural crest origin. And you can read here, cells from ectodermal placodes together with the neural crest, they can form ganglia for the cranial nerve number 5, 7, 9, 10. Sensory ganglion for these nerves are made by neural crest and ectodermal placodes. Do you know what is that, ectodermal placodes? For the eye, for the ear, for the nose, because these structures, they are sensory. You know that they receive sense. For example, eyes, they receive the vision, seasight. Okay, they have the, for example, this ability, they can receive the information from the color and light like this. Ear can receive the information about sound. Nose can receive information, for example, from taste. So they have sensory organs. First of all, in the fetus, you can see some placodes in the ectoderm. You know that ectoderm is the outer layer. Then we have mesoderm and we have endoderm. I told you gastrulation, okay, in the previous session, when the two layers of the embryo, epiblast and hypoblast, change to the three layers, ectoderm, mesoderm, endoderm. We call in the second week, we call that gastrulation. So then ectoderm, mesoderm, endoderm, they can produce everything in the embryo and fetus. So in the ectoderm outside, you have some placodes. These are for sensory organs, okay? For example, look at here, otic placode. Like otic ganglion, I told you, it's for ear. Otic refers to the ear. I told you, we have an instrument, we say otoscope, for checking the inside of the ear. The name of this instrument, when you see inside of the ear, for example, the tympanic membrane and external acoustic meatus is otoscope. So otic placode here, this plates, small plates here, we call it otic placode. So it's then can change to the ear and some sensory receptors of the ear. We have again otic placode, we have lens placode. Look at here. These are, then they can receive, yes, for the eye, they can make the receptors for the eye, in the eyeball. So all of these sensory organs, they have placodes. So this sentence in the previous page, it says the cells from placodes and neural crest, they can make ganglion. So ganglion for the sensory, for example, nerves, for number 5, 7, 9, 10. Neural crest again is here with some placodes, okay? So the blue color is neural crest. I told you the origin. So if I ask you, for example, maxillary bone, mandibular bone, visceral cranium, what is the origin of the bones? For the visceral cranium, you say neural crest. But as you can see, the posterior side of the skull, like occipital bone, parietal bone, and posterior side of the temporal bone, the petrous part of the temporal bone, okay? These parts of the skull, the posterior side, you can see the red color. What is the red color? I told you, paraxial mesoderm. This is paraxial mesoderm, somites and somitomers. I showed you again in the previous session about the three parts of the mesoderm. Ectoderm is outside, making epidermis, skin, and nervous system, ectoderm, making epidermis, skin, and nervous system, and you can see that in the some parts. Mesoderm is the middle layer. It can make, for example, muscles, bones, vessels, everything, mesoderm, mesenchyme of all of this. And endoderm, I told you, it's the inner layer of the organs, inner layer of the digestive system, respiratory system. This is endoderm. So mesoderm has three parts. I showed you when you found neural tube, and notochord, you have mesoderm. One mesoderm is here, paraxial mesoderm. One mesoderm is here, intermediate mesoderm. And the lateral mesoderm, we say lateral plate mesoderm. These are three mesoderms between ectoderm and between endoderm. Ectoderm, endoderm, and this is mesoderm. This is neural tube, then it makes a spinal cord. So this one is paraaxial mesoderm. Then it can make vertebral column. It can make some bones in the skull. It can make ribs, paraaxial mesoderm. So the red color in the skull, the posterior side of the skull, the origin of the bones are from paraaxial mesoderm. Paraaxial mesoderm. The somites and somitomer, they are here. And the last one is lateral plate mesoderm, this one. I told you, usually lateral plate mesoderm is the four muscles of the body, muscles of the trunk, outer wall of the trunk, and the outer layer. And the inner layer of the lateral mesoderm is for the layer of the organs. For example, outer layer of the stomach, outer layer of the intestine. So you can see the yellow color, cartilage in the larynx. The origin of these cartilage are coming from lateral plate mesoderm. So neural crest, paraaxial mesoderm, and lateral plate mesoderm, they're making bones in the skull and also in the neck, as you can see in the picture. Then I told you we have one important shape for the head and neck. If you know this shape, you can understand approximately everything in the head and neck. What is that? It's pharyngeal arch, pharyngeal pouch, and pharyngeal clefts. Clefts or groove. Look at here. What are these structures? Look at this picture. So let me show you better initiate arch from the. So this picture you can see here. Look at the pharyngeal arch. 1, 2, 3. I told you we have 5 pharyngeal arch. They are like a fold. You can see that in the head and neck region. They have this shape, pharyngeal arch. Between pharyngeal arch, you have pharyngeal cleft. This is pharyngeal cleft. Between 1 and 2, you have cleft. Between 2 and 3, you have cleft. Between 3 and 4, you have cleft. Between 4 and 5, we don't have 5. Pharyngeal arch, I told you, is number 1, 2, 3, 4, 6. Number 5 is disappeared. So we don't count that now. You say a pharyngeal arch, number 1, 2, 3, 4, and 6. So between 4 and 6, we have another cleft. Then I told you pharyngeal arch. Between them, pharyngeal cleft. At the end of the pharyngeal cleft, you can see pharyngeal pouch. It's like a dead end. It's like a fossa. You can see them. These are pharyngeal pouch. I will show you pharyngeal pouch. So, what are these structures? They are from ectoderm, mesoderm, and endoderm. You can see them in the head and neck, in the embryo after, for example, 4 weeks. You can see this, look at the A is 25 days. Approximately, it's at the week 4. So B after 28. When 4 weeks is completed, you can see the arch. And you can see cleft between the arch. So these arch have ectoderm, mesoderm, endoderm. So it's related to the neural crest. It's related to the lateral plate mesoderm, like bones, muscles. So let's see what they can make these arch. I told you, this table is important. We have 5 arches now. Pharyngeal arch number 1, pharyngeal arch number 2, pharyngeal arch number 3, and 4 and 6. 5 arch. Each arch, each arch has a specific nerve. So it can help you to understand the muscles are made by this arch. I told you, for the pharyngeal arch number 1, the first arch, the nerve is trigeminal nerve. For the first arch, it has name, we say mandibular arch. but you can say pharyngeal arch number 1, the first pharyngeal arch. The nerve is trigeminal nerve. For second pharyngeal arch, the nerve is facial nerve. Second, you can say hyoid arch because it makes hyoid bone, but you can say second pharyngeal arch, the nerve is facial. For the third pharyngeal arch, the nerve is glossopharyngeal. For example, I ask you in the final exam, what is the nerve for the second pharyngeal arch? Facial nerve. What is the nerve for the third pharyngeal arch? Glossopharyngeal. So you should know these nerves can help you. And pharyngeal arch number 4 and 6, they have one nerve, vagus nerve, but two branches of the vagus nerve. It means pharyngeal arch number 4 and pharyngeal arch number 6, they receive vagus nerve, yes. But this one, superior laryngeal nerve, this one, recurrent laryngeal nerve. So both of them are innervated by vagus nerve, but number 4 by superior laryngeal, number 6 by recurrent laryngeal. So when you know the nerve, then I told you, you can estimate, you can predict which muscles are made by this arch, because this arch, they can make bone, they can make skin, they can make muscle, so everything in the head and neck, each arch. So the first arch has muscle, bones, and like this. So the first arch, what was the name? Trigeminal nerve. So trigeminal nerve innervates which muscle? So then you review that. Trigeminal nerve is cranial nerve number 5. Ophthalmic is sensory. Maxillary is sensory. Mandibular is motor, sensory and motor. So mandibular nerve for masticatory muscles, and for the mylohyoid, anterior belly of digastric, the main trunk of the mandibular nerve, for the medial trigoid, tensor villi palatini, tensor tympani. So all of these nerves are innervated by mandibular nerve. They are made by the first arch. So maybe I ask you in the final exam, which of the following muscles are made by the first pharyngeal arch? Each muscle is innervated by mandibular nerve. So maybe I put here mylohyoid, yes, is innervated by mandibular nerve. Maybe I put, for example, temporalis muscle. Yes, this is masticatory, is innervated by my anterior belly of digastric. Yes, so you should know the nerve here. There you can understand. What about the bones? Which bones are made by the first arch? So the bones of the face, the first arch is here around the oral cavity, lips. It has one maxillary part here, one mandibular part here, and one frontonasal part. So the first arch, I can say, it's making the viscerocranium. Maxilla, mandible, zygoma, this some part of the temporal. These bones are made by the first arch, and also two ossicles in the tympanic cavity. I told you in the middle ear we have 3 bones, malleus, incus, and stapes. Malleus and incus are made by the first arch, because here we have a cartilage. Yes, so look at the bones, maxilla, zygomatic, temporal, mandible, malleus, incus, some ligaments, the sphenomandibular ligaments. Look at this picture. First arch also has one temporary cartilage. It's not always seen in the fetus or embryo. It disappears very soon. What is the name of the cartilage? Meckel cartilage. This red color, it's in the first pharyngeal arch. It will disappear very soon, but the end of the Meckel's cartilage can make 2 ossicles in the middle ear, malleus and incus. And look at here, nasal placots. I told you placots for the sensory organs. So nose also has receptors for the smelling. It has placots, you can see. So guys, the first arch, it has mandibular prominence, it makes mandible. Maxillary prominence, it makes maxilla, because all of these bones are from the first pharyngeal arch. It has frontonasal prominence. for the nose and this region. Okay, they are around the oral cavity. Osteomodome, I told you, it's this one. The beginning oral cavity, then it has membrane, oropharyngeal, bucopharyngeal membrane, then it has rupture and making oral cavity. So this is the first arch. Look at the second arch. Second arch has name, we can say hyoid arch. What is the nerve? Facial nerve. Then you understand. Every muscle is innervated by facial nerve is made by the second pharyngeal arch. So which muscles are innervated by facial nerve? So facial nerve finally comes to the face and innervate all of the facial muscles. So all of the facial muscles are made by the second arch. In the neck, facial nerve has branch for the posterior belly of digastric and stylohyoid. So these two also made by second arch. In the middle ear, stapes, malleus incus stapes, the third ossicle has muscle, a stapedius muscle. This one also innervated by facial nerve. So this one is again made by the second arch. So facial nerve and facial expression muscles, all of them. A stapedius in the middle ear, posterior belly of digastric, stylohyoid. So again, if I ask you in the final exam, which of the following muscles are made by the second pharyngeal arch, you should pay attention to the innervation. Which muscle is innervated by facial nerve? You know from the head and neck, I explained for you. Then you select the muscle is innervated by facial nerve, like posterior belly of digastric. This is correct. Which bones are made by the second arch? So look at the muscles, stylohyoid, posterior belly of digastric. So it's hyoid bone, upper part of the hyoid bone, and lesser horn. Some part of the temporal bone, styloid process, is this region. First pharyngeal arch is here. Second pharyngeal arch is here. So look at the bones. And in the middle ear, malleus and incus from the first arch, but the third ossicle, stapes is from stapes is from the second pharyngeal arch. A styloid process, yes. A stylohyoid ligament, lesser horn of the hyoid bone, and upper part of the hyoid bone. If this is hyoid bone, lesser horn, greater horn, the upper part of the body, and lesser horn. These are from the second arch. But the lower part of the body and great horn, they are from the third arch, pharyngeal arch. Look at the third pharyngeal arch. I told you this table is important. If you understand this table, you can go ahead and read all of the sentences. It's logical, you can understand them. The nerve for third pharyngeal arch is glossopharyngeal nerve, cranial nerve number 9. This nerve just innervates one somatic muscle, a stylopharyngeus. Just innervates a stylopharyngeus muscle. So the third pharyngeal arch, the nerve is glossopharyngeal, and it can innervate just one muscle. So it makes just one muscle, a stylopharyngeus. But the muscle of the tongue is not by glossopharyngeus. Good question. It goes to the epithelium, the outer layer of the tongue. Like a skin, for example, I told you in the previous session, I told you facial muscles are made by which arch? Facial muscles, second arch. Facial muscles are innervated by facial nerve, so they are made by second arch. But what is the sense of the face? Is trigeminal nerve, is from the first arch. So you say how? The muscles here is by the second arch. They are innervated by facial nerve, but the skin is here, is innervated by trigeminal nerve first. Yes, because the skin coming from the first arch, the muscles coming from the second arch. Sometimes we have this condition. So in the tongue is same. Okay, the muscle is not from the arch. The muscles come from somites, from the occipital region. For this reason, the innervation of the muscle in the tongue is hypoglossal nerve, is not from the arch. But you can see the outer layer, the sense, yes, they are coming from the arch. Which structure, which bones are made by the third arch? So I told you, lower part of the hyoid body, lower part of the hyoid body, and greater horn of the hyoid bone. Lower part of the hyoid body and greater horn of the hyoid bone. And finally, arch number 4 and arch number 6, pharyngeal arch. I told you both of them are innervated by vagus nerve, one of them by superior laryngeal, one of them by inferior laryngeal. Again, look at the larynx, for example, this is larynx. Under, okay? The sense of the larynx, the upper half is by superior laryngeal. It has internal laryngeal nerve, external laryngeal nerve, so it's from superior laryngeal nerve. The lower half of the larynx, the sense is by recurrent laryngeal. It's by recurrent laryngeal. This one is superior laryngeal. Okay. What about the muscles? You know that we have a lot of muscles in the larynx between cartilages. You know that only one muscle is innervated by superior laryngeal, cricothyroid. The lateral or external laryngeal nerve, the superior laryngeal, just innervated one muscle, cricothyroid. Other muscles in the larynx are innervated by recurrent laryngeal. So you can understand this. And these two arches making the cartilage of the larynx. So in the picture I showed you, larynx was yellow. I told you lateral plate mesoderm. Yes, the mesenchyme coming from lateral mesoderm. But in the face, I told you, they were blue. So it means the mesenchyme coming from neural crest. No matter, they come finally in the arch. We don't talking about source. We're just talking about arch. We say first pharyngeal arch making this. Second pharyngeal arch making this. The third making this. But you know that first pharyngeal arch, the bones, for example, coming from neural crest. And the mesenchyme coming from neural crest. But these are coming from the lateral mesoderm, no matter what is the source. Then I told you each arch has branch. Then I talked about osteomodome. It's here, the first oral cavity. It has membrane, buccopharyngeal membrane. Then it has rupture. You can see the first arch here around the osteomodome. Let me explain. Again, we have it in the nasal cavity. You know that around the osteomodome, you have 5, like tubercles, 5 prominence. 2 mandibular, 2 maxillary, and 1 frontonasal. So these are made by the first arch, all of them. The mandibular, the maxillary, and the frontonasal. They are made by the first arch. So what happened? Mandibular arch attached together, making mandible. Maxillary arch attached together and making maxilla. Frontonasal also is here attached to the maxillary and making upper lips and also the nose. I will explain for you. Look at the second arch, but second arch is here. Which bones are made by second arch? I told you. Upper part of the hyoid, lesser horn of the hyoid, and styloid process, so you know that. Innervation for each arch. The first arch I told you. So bones are maxilla, mandible, zygoma, temporal. These bones are made by first arch muscle. I explained for you. And the innervation is trigeminal nerve, so it can make masticatory muscles. Second arch, the nerve was facial nerve. It can make facial muscles. Second arch also has cartilage. Second arch. First arch, I told you it has 1 temporally cartilage, it's Meckel cartilage. The second arch, the cartilage is Richard cartilage. Again, this one is disappear and just making the stapes. The third ossicle. You can see that stapes from the second arch, but malleus and incus from the first arch. They are made by first arch. You can see the yellow color by the third arch, the lower part of the hyoid bone and greater horn, and thyroid cartilage and other cartilage by arch number 4 and 6. Upper part by number 4, lower part by number 6. Third pharyngeal arch, the nerve is glossopharyngeal. The only muscle we have here is stylopharyngeus, and the bones are lower part of the hyoid bone and lower part of the hyoid bone and greater horn. Arch number 4 and 6, I explained for you. The nerve is vagus nerve, superior laryngeal and inferior laryngeal. Let's go to the parts and cleft. So, as I told you, now they are opened the embryo. The embryo, they opened that. Okay, imagine embryo is like tube. They opened that. Look at here. This is arch number 1. This is arch number 1. They opened that and they show you like this. Okay. Arch number 1 and arch number 2, you can see cleft between them. This is the cleft. Between arch number 1 and 2, this is the cleft. Number 2 and 3, this is the cleft. Number 3 and 4, cleft. Number 4 and 6, this is the cleft. So between them, we have fissure, we have cleft. Okay, pharyngeal cleft. Each cleft, at the end, it has pouch. Pouch is like a dead end, it's like a fossa. Look at here. This is the first pharyngeal pouch. Second, third, and fourth. So we have 4 pharyngeal pouch. Where is the location of the pouch? At the end of the cleft. Pharyngeal cleft. Where is the location of the cleft? Between the arch. Okay. Look at this table. This table is a summary from the pouch. So if you know this, you can understand the sentences we have after that, the slides we have after that. First pouch, making some structure. Second pouch, some structure. Third pouch, and the last pouch. The first pharyngeal cleft, the first pharyngeal cleft, this one. The first pharyngeal cleft between the first pharyngeal arch and second pharyngeal arch. I told you here is the first pharyngeal arch, here is the second pharyngeal arch. Between them you have cleft. This cleft making external auditory meatus, an external auditory canal. So this you can see here, the external acoustic meatus and external acoustic canal, it's made by the cleft. Okay, it's logical. And I told you at the end of the cleft you have pouch. At the end of the cleft you have pouch. So in this way you can understand this. The first cleft making external acoustic meatus and the first pouch making the tympanic cavity. Making the tympanic cavity, the middle ear. After the external ear, you go to the middle ear. So look at the table. The first pharyngeal pouch making tympanic cavity, middle ear, and eustachian tube. Middle ear and eustachian. So if I ask you in the final exam, which of the following structures is made by the first pharyngeal pouch, you should know that tympanic cavity and eustachian tube. What about the second pharyngeal pouch? Second pharyngeal pouch can make palatine tonsil and tonsillar fossa. Where is that? Palatine tonsil. Yes, oral cavity, lateral to the oral cavity between the two arch, palatoglossous, palatopharyngeus, we have palatine tonsil and palatine fossa or tonsillar fossa. It's here. So the second pouch making this. The second pouch, it was in the second cleft between the arch. So what about the third pouch? The third pharyngeal pouch can make inferior parathyroid gland. You know that behind the thyroid gland, we have 2 superior parathyroid gland and 2 inferior parathyroid gland. The inferior parathyroid glands are made by the third, but superior are made by fourth. It's opposite. Don't confuse. The superior is not by 3, the inferior by 4. No. The inferior is pouch number 3, but the superior is patch number 4. Why? Because the patch number 3 making the inferior parathyroid gland, because they should go down sooner and they go to the location. They have descending, they go descends and they go to the correct location. They made here in the, in the third patch, then they go down and they go to the location. For this reason, we need to migrate first. So the third patch making inferior parathyroid gland and go to the location. Then patch number 4 making superior parathyroid gland. So the third patch making inferior parathyroid gland and thymus. Making inferior parathyroid gland and thymus gland. Patch number 4 can making superior parathyroid gland and some part of the thyroid gland, ultimobranchial body, making parafollicular C-type cells in the thyroid gland. So this is the patch number 4. So if we know the patch and this table, we can understand how they can make the first patch, tympanic cavity and eustachian tube, second patch, palatine tonsil and tonsillar fossa, the third patch, inferior parathyroid gland and the thymus, and the last one, superior parathyroid gland and the parafollicular C-type. So we pass from the patch, and after patch, we should talk about cleft. I told you cleft, they are located between arch. Between two arch, you can see cleft. This is the first cleft, second cleft, third, and like this, okay? You can see just the first cleft. And I told you it making external acoustic meatus, okay? Just you can see the first cleft. What about other clefts? You can't see the other clefts. Why? Because this arch they become very big and they can cover the second arch, the third arch. They become very big and they can cover the clefts. So you can see clefts, and clefts don't make any important structure. Okay, so just we know that we have one cleft, the superior one or the first one. So pharyngeal cleft at the week 5, you can see pharyngeal cleft between arch. The first pharyngeal cleft can make external auditory meatus. External auditory meatus. For the external eel, instead of even formed by organizations related to the first pharyngeal arch, overgrowth of the second arch, it's formed more cascade. Other clefts are disappear, activate proliferation of mesenchymal tissue in the second arch, cause to overlap with the third and fourth arch, so we can't see any cleft. Just the first cleft can be seen. It merged with the epicardial ridge in the lower part of the neck, and the second, third, fourth cleft lose contact with the outside, so the clefts from a cavity lined with ectodermal, the cervical sinus, but with further development, this sinus disappear. So just the first cleft. We have know the important point, and the first cleft making external auditory meatus. Other clefts are finally disappear. Okay? So it's first ectoderm of the first arch. Look at here. When we say the first cleft, as you can see here, the first cleft, this groove, making the location, making the canal. But I told you each part, when we talk about that, the arch, the patch, the cleft, all of them, they have this layer. They have ectoderm, they have mesoderm, they have endoderm like this. If you have sensory parts, so they have ectoderm. I told you all of them, the placodes for the sense, for the nose, for the eyes, for the ear. When you have receptors and you have sensory organs, they're made by the neuroectoderm and ectoderm. Okay? And the epidermis is from ectoderm again. So when we say arch, I told you the first. They have all of this layer. You have ectoderm, mesoderm, and endoderm. Okay? Yes. Yes. No, 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 no. Arch, they don't make nerve. Nerve is from the nerve, they are from the CNS and PNS, they are coming from the neural tube and from the development of the CNS and PNS. Then nerves go to the arch. Arch, they don't make the nerves. You have arch, you have structures, muscles, then nerve go to the arch for the muscles. And when we say this nerve is for this arch, it means the nerve go to this arch. Arch don't make the nerves. Okay, did you get that? Look at this picture. Nerves from the, for example, brain, from the cranial nerves, you can see that they start from the cranium and then they go to the arch. Okay? So we explained the cleft, pouch, and arch. Let's see the tongue. So we know that from anatomy of the, for example, oral cavity and GI system, tongue innervation is a little complex. So it's about that when you see a complete tongue, you have this shape, you have V-shape sulcus or groove, terminal sulcus. At the center of this sulcus, you have foramen secum, the anterior two-thirds, and the posterior one-third. Posterior one-third is root and the posterior side, but the anterior two-third is body and the free part, you can move it. The general sense for the anterior two-third is lingual, but the special sense is chorda tympani. So lingual nerve is from the cranial nerve number 5, but chorda tympani is from cranial nerve number 7. So what does it mean? Which arch? Facial, this one for the first arch, this one for the second arch. The posterior one-third of the tongue, the general sensory and the special sensory is glossopharyngeal. Glossopharyngeal, cranial nerve number 9. It's same, cranial nerve number 9, glossopharyngeal. From the third arch, so here is easy. The sense of here, the epithelium of the here, the outer layer of the tongue is by the third, because the nerve is glossopharyngeal for the third arch. But the anterior side, it's mixed of the first arch and the second arch. The first arch is more important, but second arch also come here. Because why? Because the special sense of the anterior two-thirds is by facial nerve, so it's from the second arch. But the general sense is from the trigeminal nerve, so it's for the first arch. So we can understand this. Arch number 1 and 2 in the tongue is here, arch number 3 is here, and you know that at the end of the tongue, when tongue attached to the epiglottis, at the end of the tongue, at the root of the tongue, when tongue attached to the epiglottis, yes, the nerve is vagus nerve. At the end of the tongue, the nerve is vagus nerve, the superior laryngeal nerve, internal laryngeal nerve. So it means arch number 4. Arch number 4 also, you can see that here, between epiglottis and root of the tongue. So by this information, you can understand these four arches can participate in the forming of the tongue. Look at the picture, arch number 1, arch number 2, arch number 3, and arch number 4. So we have 4 arch, and we can see the nerves from these 4 arch. Trigeminal nerve, facial nerve, glossopharyngeal nerve, and vagus nerve. No, vagus nerve at the end, and just the superior laryngeal, arch number 4, not arch number 6. So guys, but we know that the muscles of the tongue, the innervation is not this arch. The muscle of the tongues are innervated by cranial nerve number 12, hypoglossal nerve. So what is the reason? Muscles, then they come to the tongue, they are from the somitomers and somites from the posterior side. They are not from the arch, they are from the back. So the muscles, because come from somites in the occipital region, so the nerves also come from the hypoglossal nerve, cranial nerve number 12. So you can explain that like this. The muscles, they are not from the arch. But the outer layer, the epithelium, the mucosa, these are for the arch. Okay? What is the reason we can see this foramen in the tongue, foramen secum? Yes, thyroid gland also is formed here between the arches in the tongue, between the anterior 2/3 and posterior 1/3. Then thyroid gland go down to the anterior side of the larynx and trachea. We say thyroglossal duct. Thyroglossal duct, after thyroid gland go to the location, for example, I think after 2 months, after 7 weeks, it goes to the location, and after 3 months, thyroid gland starts to produce hormones. Okay, so this duct disappear. Thyroglossal duct disappear, and you can see a small closed foramen. We say foramen secum. It's here. So this is the formation of the tongue. Let's have 5 minutes, then we continue and finish the embryology. Know this general information, which arch, for example, are innervated by which nerve, which pouch making, which structures, and for example, tongue, which arches are located here. You should know this general information. We don't emphasize on the details because it's not very necessary for you. For example, look at here, the first arch in the tongue, it has 2 lateral lingual swelling, lateral lingual parts, and 1 tuberculum impar. Impar means single. Munfarid, single, 1. So these 3 parts in the tongue, as you can see, 2 lateral lingual swelling and tuberculum impar, they are from the first arch. Then they attach together and making the body of the tongue. Instead, the second arch is very small. I told you the second arch is not very obvious, but the sense of the a special sense of the anterior 2/3 is made by the second arch. And look at the third arch. It has copula. It's the like a tubercle from the third arch, and between copula and the anterior arch, you can see foramen secum. So foramen secum is here. Yes, we know that because foramen secum is anterior to the, this is posterior 1/3, and foramen secum is here. If here is the third arch, so foramen secum is anterior to the third arch, as you can see, is anterior to the copula. It's foramen secum, and finally, end of the tongue attached to the epiglottis. It has epiglottic swelling and the sense here by internal laryngeal. All of these parts then attach together and make the final tongue. We know that the anterior 2/3 Arch number 1 and 2 is here. The posterior 1/3. Arch number 3 is here. Between them, we have foramen cecum. And finally, root of the tongue attached to the epiglottis at the sense is by the vagus nerve. And I told you about the muscle. You can read all of this information I explained for you about the spatial sensory, general sensory. I explained all of them for you, and you can understand them. So this is the formation of the tongue. But look at the muscles here. Again, it explains. The epiglottis and extreme posterior part of the tongue are innervated by superior laryngeal nerve, reflecting that fourth arch is here. Some of the tongue muscles probably differentiate in situ, but most are derived from the myoblast originating in occipital somites. So thus, tongue musculature is innervated by hypoglossal nerve. It means muscle of the tongue is not by the arches. Muscle of the tongue coming from occipital region, occipital somites. So for this reason, the nerve is hypoglossal nerve, cranial nerve number 12. Thyroid gland. Thyroid gland, again, I explained for you. It's originated in the epithelium and the region we have tongue, epithelial proliferations in the tongue, in the foramen cecum, between anterior 2/3 and posterior 1/3. And it has a duct. It has a duct here to foramen cecum. We say thyroglossal duct. It helps thyroid gland go down and locate here, anterior to the larynx and trachea. In the thyroid gland, I explained for you, the parafollicular cells, ultimobronchial cells, they are coming from the pouch number 4. Pouch number 4, I told you, they make superior parathyroid gland and type C parafollicular cells. So yes, C cells. So follicular cells, they make colloid and thyroxine and thyroidine. Parafollicular cells for calcitonin, they are here and from the fourth pouch. We know that at the 7th week, the thyroid gland go to the location, comes here. And after 3 months, it start the function, producing the hormones. And at the end of the 3rd month, it start the secretion of the hormones, and it has colloid in the gland. Colloid become visible. So if I ask you at which age of the fetus you can see colloids, or for example, you can see function in the thyroid gland, you say at the end of the 3rd month. Face. Face has 2-3 important points. I told you in the skull, the bones of the face, viscerocranium, the blue color, they are from neural crest. Okay. The bones of the face, the blue color, they are from neural crest, viscerocranium, neural crest. Which arch is here? First arch. It has maxillary prominence, mandibular prominence, frontonasal prominence, all of these 5 prominence tubercle, 2 mandibular, 2 maxillary, and 1 frontal nasal. They attach together and making face. The mandible, the maxilla, zygoma, nose, all of them. So we have this structure. Also, you have nasal placodes. I told you several times. Placodes are the sensory parts from the ectoderm. Then they go to the nose, ear, eyes, and we have otic placode for the ear, lens placode for the orbits, nasal placode for the nose. These are sensory receptors, no problem. So what happens after 2 weeks? Look at here. When frontonasal, we have this shape. 1 frontonasal prominence, 2 maxillary prominence, and 2 mandibular prominence. And osteomodome is here. The mouth is here. Okay? 2 maxillary prominence attached together to making maxilla and upper lip. 2 maxillary prominence attached together. And by this condition, frontonasal prominence it has two nasal parts, lateral nasal and medial nasal. This one was frontonasal prominence. When maxillary prominence attached together, making maxilla and upper lip, okay, upper jaw, the nasal part of the frontonasal divides to the two, lateral nasal and medial nasal. Lateral nasal and medial nasal in two sides. This is lateral nasal, this one is medial nasal. Look at the picture. So these are mandibular part, mandibular arch from the first, all of them are from the first arch. These are maxillary prominence, and this one is frontonasal prominence. Then, look at here. Then maxillary prominence, the red color. Mandibular prominence, these are. And look at this yellow and blue color. This is frontonasal prominence, the nasal part. I told you divide to the two parts. The blue color lateral nasal, the yellow color medial nasal. The blue color lateral nasal, the yellow color medial nasal. This one is important. I emphasize because lateral nasal and medial nasal, they are important. So what happens? Look at here. You know this picture. Mandibular here in the mandible, maxillary, the red color in here in the maxilla, and frontonasal, the nasal part has divided to the two parts, lateral and medial nasal. Lateral and medial nasal. So look at the next picture. Okay, this is a good picture. Finally, look at this attachment. The red colors, they are maxillary prominence for the maxilla. Attached together. They want to attach together. During this attachment, two medial nasal prominence attached together. Look at here. Yellow color medial nasal, blue color lateral nasal, yes? When the maxillary bones, they want to attach together, the two medial nasal prominence attached together at here. So medial nasal come here. Here of the lip, we say philtrum of the lip. This flat region in the lip at the midline, philtrum of the lip. So what does it mean? Upper jaw here is made by two maxillary prominence and medial nasal prominence. They are here in the upper lip. Two maxillary, and at the center, medial nasal, the yellow color. Lateral nasal, they are not in the upper lip. They are here, lateral. All are part of the nose. All are part of the nose, the blue color. You can see in the picture. Look at the mandibular prominence. Mandibular prominence attached together and making mandible and lower lip finish. Mandibular prominence attached together and making mandible finish. So in this way, we can see nose and the function of the lateral nasal prominence and specifically medial nasal prominence, they are very important. Look at here, medial nasal, then attached together and making here. I will explain for you intermaxillary plate. I will explain for you. It's very important. So look at here, intermaxillary segment. What is that? Intermaxillary segment. Intermaxillary segment exactly is the two medial nasal prominence. When two medial nasal prominence attached together, the yellow color, we call that intermaxillary segment. Is not just here, it's deep. Also, it goes to the hard palate. Okay, so look at the picture again. Yes, it's here at the hard palate. So look at here, when upper jaw or upper lip is made by two maxillary prominence and two medial nasal prominence, they attach together. You can see this segment here. This segment, the yellow color, we call it intermaxillary segment because it's between two maxillary prominence. Intermaxillary segment make three parts. Intermaxillary segment make three parts here. So the philtrum of the lips here, the philtrum of the lip. Four incisive teeth. Four incisive teeth also is made by intermaxillary segment and the hard palate, the primary hard palate. So everything in the midline here is made by intermaxillary segment. Look at here. 1. Philtrum of the upper lip, it means here, is made by intermaxillary segment. 2. 4 incisive teeth, to here, made by intermaxillary segment. And 3. Hard palates, the primary hard palate. The first small hard palate here is by the intermaxillary segment. And I told you, intermaxillary segment is the attachment of two medial nasal prominence. Attachment of the two medial nasal prominence. So you should know that. If I ask you, all of the following structures are made by intermaxillary segment. Philtrum of the lip, it's correct. 4 incisive teeth, it's correct. Canine teeth, no, it's not correct. Canine is not. And primary hard palate, this one is correct. And how we can see intermaxillary segment? By attachment of the two medial nasal prominence. Attachment of the two medial nasal prominence. You have intermaxillary segment. Okay? So this one in the face is important because making nose, lips, teeth, and hard palates. No, look at here. Neural crest, they are mesenchyme here. The mesoderms here, they are made by mesenchyme. I showed you the picture. The blue color, all of them are neural crest. Yes, we know that the mesenchyme is neural crest. But when we talk about arch, then we explain this fold and the change in this fold. Yes, the material is from neural crest. Exactly. And I told you the arch has ectoderm, mesoderm, endoderm. So the mesoderm here is just from neural crest. Look at the primary plate in the hard palate. I told you this one also from intermaxillary segments. So you can see in the picture the 4 incisive teeth, the primary hard palate, philtrum of the lip are here. So what about the other part of the hard palate? Hard palate is very big. We say second palate or secondary palate, making the other part of the hard palate. So what is that? So you can see 2 like shelf. Do you know what is the meaning of shelf? What you say in Arabic to shelf? Shelf, you know, for example, you put book on the shelf, you have these structures. Okay? Rough? Okay. So we have 2 shelf for palette. Then they attach together. Look at here, these are shelf. Right side and left side. Then they attach together and making complete hard palette. In the newborn, in the baby, maybe you can see these problems. You can see cleft in the lips, or you can see cleft in the hard palate. So now you know what is the problem. If it's in the midline, the problem is, we say, look at here, number A, number B, number C, number D. Midline cleft for the lip. It's for intermaxillary segment. You know that it's here, 2 internasal, medial nasal prominence attached together. So if you have problem here, you can see cleft in the midline. Sometimes the cleft is lateral. Look at here. It's not in the midline. It's here, lateral to the nose. So it means it's for the lateral nasal prominence, because the alar part of the nose is made by lateral nasal prominence. It's the junction of the lateral nasal and the maxillary prominence. Let me show you where is it. If the problem is lateral, it means it's here, between blue and red. Blue is lateral nasal and red is maxillary prominence. But if the cleft is in the midline, it's in the intermaxillary segment. And sometimes the cleft is in the hard palate. It's not in the lip and the anterior side. The cleft is very big, and you can see that, for example, in hard palate. We say palatine cleft. Cleft of palate. Number B, you can see all of the palates is open. So this one is for the secondary palate. The shelf I told you, then attached together. So these are the embryonic problems in the face development, specifically for intermaxillary segments and palatine formation. So we explained them. I told you in the face, we have medial nasal prominence, lateral nasal prominence. mandibular prominence, maxillary prominence, and frontonasal. For example, mandibular making lower lip, maxillary making the cheeks, the zygoma, this region, and upper lip, medial nasal, intermaxillary segment, philtrum, crest of the nose. Crest of the nose means this anterior side of the nose. Lateral nasal for ala, for the outside, and frontal nasal is here for the frontal region, top of the nose. Okay, these are different parts of the face. Intermaxillary segment is yellow color. Two medial nasal prominence attached together and making here philtrum of the lip, four incisive teeth, and the primary palate. So this is the explanation. Two medial yellow color, medial nasal prominence attached together, making philtrum of the lip, four incisive teeth, and this yellow color, and the primary palates. Okay. Nasal cavity, I told you we have nasal placoid, then we have nasal foramen, and some ectoderms go to the nasal cavity. They can make the sensory receptors for the nasal cavity. We don't need the details. Just know that generally nasal cavity, then it has oronasal membrane, it has rupture making nasal cavity and oropharynx, nasopharynx. It's not very important, the details. So look at the incisive foramen. Look at the incisive foramen in the hard palate. It's specifically between primary palate and secondary palates. Okay, you can see that between intermaxillary segment and the shelf. And the last one is teeth. So again, it has a lot of details, but it's not necessary for you. As you can see, teeth is made by the epithelium of the mouth. The epithelium, the blue color, go to the mesenchyme. Mesenchyme of this region, we know that is from neural crest, because mesenchyme of the upper jaw and lower jaw, the blue color, it was for the neural crest. So you can see that epithelium of the oral cavity goes to the mesenchyme. Mesenchyme is from the neural crest. Then the epithelium, we say dental bud. Do you know the meaning of bud? What does it mean? Grows for the first time, the beginning of the, for example, plants, flower, we say bud. What do you say in Arabic? Okay, this is dental bud, the beginning of the, teeth. Then it makes like hat. It's collect the dental papilla. Dental papilla again is from the mesenchyme of here. It's from neural crest. Then this dental papilla, okay, divides to the two parts, lateral part, medial part. Inside it has some stellate retinoculum, it's from neural crest, and they change to the amyloblast, then odentoblast. It's not very important, the details, but the beginning you should know that. It's interaction between epithelium of the oral cavity and mesenchyme of the neural crest. Then the first stage is dental bud. You know that how many milky teeth we have? 20 milky teeth, 32 permanent teeth. So all of them is made in the fetal period. It's not like that. For example, the permanent teeth, they grows after, for example, the child go to the 6 years, 5 years. No. All of them, they are made in the fetal period. 20 milky teeth and 32 permanent teeth. The dental bud, then we have dental papilla, then it divides to two parts. You can see enamel, dentine, cementum, and this structure. The detail is not very important, but know the general function, what happens here. So this is teeth, just read this explanation is enough. And so this is the embryology. If we have 40 questions for the final exam, the theoretical part, we have 2 scores for here. It means we have 4 questions from the embryology. So other questions are from the skull 1, skull 2, neck 1, neck 2, neck 3, face 1, face 2. We have question, you have 40 MCQ question for the theoretical part. For the practical part, you have 14 pictures. And also your score from the practical exam and quiz I will combine that. I will add some score to you. So if you have any question, any problem, you can ask. At the 10, we go to the practical. The students who I evaluated them yesterday and they got good score, they don't need to come again. But the students I did not evaluate them or they were absent, they can come here. I put the name in the list and I can put the score for the practical. Okay, I will see you at 10. Here you
Thank you, Dr.